Hello and welcome to this video on female leaders and COVID-19. Are women better at dealing with disaster? Now, obviously this pandemic has affected all of us and it has affected our education and our understanding of sociology. And this was inspired by a set of articles and ideas that I saw cropping up in the media. And I thought it would be a really good way to explore and explain the realities of this pandemic, the realities of what it's doing to our societies and how it affects your learning as sociologists. Now, I am not a doctor. I have no medical background. I am a high school teacher, obviously. There is a list of the websites I've used to compile and compare data to do this. I've tried to be as thorough and extensive as I can be, spending many hours on it. Likewise, I've selected 4 articles which I think show this theme really well, but also explain it in a way which is easy to understand and gives off a lot of information and ideas which we can unpick as sociologists and link to our learning. I hope you're all doing very well at this time, and I hope that this video reassures you and in no way comes across as trying to exploit the situation or in some way of making a political point in any way. That is not my intention. I hope that we look at this entirely sociologically. One thing which may be really clear to you at this time is the media's relationship and the cult of leadership, and not just the media in terms of the mass media, but social media too. There is a cult of personality, and often these are associated with our Prime Minister Boris Johnson and the American President Donald Trump. This idea of what Weber would look at in terms of charismatic leadership, and perhaps the more 20th century idea of the strongman style of leadership you might be familiar with in history when you've looked at other leaders. We might want to ask ourselves which countries have a female leader and what assumptions can we make about them. There's a really good point in one of the articles that the type of country that's likely to elect a woman is going to have different social attitudes and be in a different place to those that are going to elect a man, and perhaps a man who portrays or goes after a certain style of leadership which is very different. Why in fact are the press reporting this angle? Well, there seems to be a pattern that's emerged from the early part of this pandemic that the countries with female leaders have done better, and that is a very loaded and subjective term. People instinctively grab the statistics in the headlines and they look at it in terms of league tables. Well, we're not the worst for deaths, or we're the best for deaths, or we're doing better than X, Y, Z, our neighbours, our rivals, whoever it might be. And this might play a part in it. There might be a way of looking at where geographically, where are these leaders situated and what do they have in common and what differences do they have amongst them. And then are there any sociological concepts which immediately spring to mind? Does the fact that a woman in a leadership role is still expected to have the same maternal instincts or the same tone as we would look at in the family section? Would a female leader be more equipped to dealing with a medical emergency rather than, say, one of war? And we make these kind of gender assumptions. Could that explain it? Could there be some sort of bias and stereotyping going on which is allowing these female leaders to be perceived in one way versus male leaders which are being criticised, or is that not actually what's happening? So all of these things you may want to consider before you even go any further with exploring this idea. Now, you may have seen this meme. This is what actually inspired me. I saw this 3 or 4 times towards the start of the pandemic, and as time went on I saw it reoccurring. Anecdotally, I saw it mostly shared by women and liked by women, and there seemed to be this idea of kind of female empowerment almost. And it does what a meme does. It's very pictorial. It lays out almost a question and pushes you towards an answer. And one thing that struck me was some of these countries are very well developed European countries. New Zealand, Taiwan, obviously not. They're in a different part of the world completely. So is the link of a female leader that strong? And the way in which it presents itself is pretty self-explanatory. You can see it there. If you look at sort of your English language skills, you can analyse that. There isn't much apart from the headline and a list of countries along with pictures to go on, really. Is it useful? Is it problematic? It depends on your bias, I guess. It depends on where you're coming from. If you see it as a good way to show, well, actually, from a feminist point of view, perhaps women in leadership should be more prominent and should be praised and receive that recognition, or maybe it's not detailed enough, it's not in depth enough, therefore it's completely flawed and perpetuates yet another myth at a time when there's a pandemic going on. We don't need to be going down that route. So you may have your own views on this already just by looking at this one image and seeing it shared and how that reflects. But it is without doubt, in my mind, an image which is fed on this angle from the press, on this trope, if you like, on this exploration of, are female leaders doing better than male leaders? And why is that important, and what does that show? So this is kind of a good example of the media reflecting on itself and reflecting the world in a really interesting way for me. Hopefully by now you've seen that I don't want you to merely accept or reject this premise. I don't want you just to go, oh yeah, well, countries with female leaders, they're doing the best, that's good for them, well done. I want you to apply some critical thinking. What evidence is there to support it? What evidence is there to dispute it? What does it show us? What does it mean? If you look at the map at the bottom, which was compiled on the 27th of April this year, it shows deaths of COVID-19 by population density, and you'll see that Europe in particular has the worst and Africa the best in terms of death rates per population, and kind of North America is a bit bad and Asia a bit better. But immediately that doesn't tell us everything. You have to look at the range of countries in there. We're talking across the globe here. There's very different demographics, very different wealth of populations, density of populations. That physical geography could be a factor here, as well as many other things that we're going to get into. And if you think of it from a political point of view, well, there are opinion polls out there, and those opinion polls will change as this disease progresses and as this situation progresses. And opinion polls of leaders can be subject to lots of different factors, such as how popular they were before, how long they've been in charge, what prejudice towards them there already is, positive and negative, how they've responded, the death rate itself, the perception of how well they're doing. All of these things can vary massively from country to country and not be very comparable. So already we've got to look at that. And cases and deaths will likely be increasing in terms of raw numbers, but in terms of proportions and spread, is it actually getting better yet or not? We don't know. One report today suggests the infection rate, for example, is going back up in Germany, which is one country we're going to look at. Does that necessarily mean that actually Angela Merkel is not doing as well or has got worse? It's too early to say. So we need to think about, there's lots of plates spinning here and lots of factors as sociologists we need to focus on and compare carefully. And then there's also the cages aspect. Who lives where? What does that mean? What does that tell us? Why might that be really significant when it comes to something like a disease? If you've got a young population versus a very old population, a rich population versus a very poor population, etc., etc., they're going to react differently to a disease, which is indiscriminate. So we need to think about that too as sociologists. I wanted to take you through a quick timeline of the media and how this idea has really evolved and gained a lot of traction. Now, the first article that is on the reading list is nothing to do with this idea of women being better leaders or not. It's about what sociology is for in the pandemic, and I think it's really essential you read it. It's a college professor talking about how they've had to totally rejig the teaching of sociology because of the situation we find ourselves in. But it also looks at this idea of, particularly if you're going to A level, how teaching the sociology of health is so important, and it helps us understand this. And it makes a lot of points that we're going to look at later, but this one, the way we organise our social lives have the biggest impact on our life expectancy, is really key here, because we can then look at different countries and what their normal life expectancy would be versus what's going on with this pandemic and with this disease, and has coronavirus totally leveled those assumptions and leveled those structures or not? Has it flipped them on its head? Has it changed things? The second article, this is why we need women's leadership. It isn't talking about running countries specifically, it's talking about across society, and it talks about how in the healthcare sector particularly, but across society, gender inequalities like access to paid work, it leaves women vulnerable to poorer health outcomes. If you think about the functionalist idea of the expressive role in women being the caregivers and looking after you guys while you're at home, as well as trying to maybe do their own jobs, or perhaps women are massively overrepresented as healthcare workers, caregivers in old people's homes, nurses, that type of idea. They're more at risk, and we're seeing that played out in the media too. So the suggestion could be that, statistically speaking, we need women considered and considering their options in terms of what they do, and it's really well put out, this article, and it will give you some food for thought, so I recommend you read that next. The next article came out on the 25th of April, so much later, and we're much more into the pandemic, and it builds on this idea, which is the whole premise of this video, and it inspired this video. It appears in the British paper The Guardian, but there's similar articles in other papers too. What I liked about this article was it takes the premise as a rhetorical question, it asks it, are female leaders doing better, essentially, and it looks at different case studies, different countries, differences in terms of leadership, differences in terms of what physical actions they did, the communication that they made, and it builds on this idea that this is what the stats look like, this is what's happened. And it quotes a sociology professor at the end, and it talks about this idea that when you're just dividing it into men and women as heads of government, it's not that useful. And we know this as sociologists, there's more going on here than just the fact these are women, they're better at managing a crisis, or they're better at managing a health crisis, because they're not in the same situation. That's something we're going to look at. The next day in Forbes, an article kind of distilling all of these ideas, all of these previous articles and previous arguments coming around, goes with this headline of why have women leaders excelled. Now, headlines don't always reflect the truth of the article. That's one of the big things we know to consider when studying mass media. But it presents a much more crystallized version of everything else that we've talked about so far. And it says, if we look at the countries that have performed the best, they're helmed by women. Their leaders have demonstrated the most decisive and calm actions and have done better for it. And this kind of builds on this idea. Are men straitjacketed in terms of having to behave a certain way, or are they simply conditioned in a way which means they're not as effective? And we need to look at what the media has been reporting at times during this pandemic, and the language that's been used by leaders and by the media, and what effect that has had on us as audience members. Okay, so I've made this graph using the best available data that I can, and I've summarized it in the chart to the left there for you. I haven't compiled all of these stats, I've merely gone through different websites and used them to create this graphic. So why might I use death per capita? Quite simply the fact that all these countries have different populations in terms of size, and physically they're different countries. St. Martin is a very small nation, United Kingdom is an island in the north of Europe. Germany sits bordered by several countries. One of them is Denmark. New Zealand is 2 islands at the bottom of the globe. Population densities, a lot of other things are very different. But in terms of raw numbers, New Zealand has a population way lower than Great Britain, so you'd expect the total number of deaths to be far lower too. If we look at it per million, we can make it a comparable way of measuring and looking at the trends and the patterns. So obviously, sadly, all of these countries, as March has kind of come to an end and lockdowns have been put into effect and the pandemic is really starting to take hold, deaths spike rapidly for all countries pretty much. New Zealand and Taiwan is not as sharp as you'd expect given their numbers. Now, the United Kingdom's deaths per million, most websites agreed it was around 305 deaths per million. One put it as high as 311. So that and Taiwan have asterisks because Taiwan's was also disputed between 0.25 and 0.3. I've presented the consensus for each country, so it's fair. But there are a lot of differences here we need to consider, not just deaths per million, where these countries are, what kind of population they have. All of these things are really important. What's the life expectancy? How has that life expectancy changed? How many old people? How many young people? What kind of manufacturing goes on in these countries? What's their economy based on? How is the healthcare system put together? They all have different answers. Obviously the United Kingdom has the NHS. It's kind of fully funded by taxpayers. Germany has a mix of state and not-for-profit and medical insurance providers, as I understand it. New Zealand is a similar kind of idea. So the health services themselves are not as easily compared to. There are many things here. In terms of how can we be sure the data is accurate, well, we can't. I've shown you my sources, I've shown you where I've got them from, you can check them yourself. It's possible I've made a mistake. It's quite possible as well that the people compiling the stats in the United Kingdom are not doing it in the same method or in the same degree as the people in Denmark or Finland or Taiwan or wherever else. So there could be countries that don't appear here but should. That's something that we as sociologists need to think about, as well as things like valid data. What's the context of these deaths? How many of these people, as sad as it's to say, would have died anyway because they're so elderly or so frail or infirm? Is that a different percentage or a different number in the United Kingdom versus Denmark or Germany, or pick any country if you like? So you need to look at that as well. There's a lot going on here. We can't just look at a graph and say, okay, that's the truth, that's it. There's more to consider. So here we have Jacinda Ardern, the Prime Minister of New Zealand, and Angela Merkel, who's running Germany. Very different women, very different political careers thus far, and very different countries, but they're kind of held up as the examples. These are the faces of managing the pandemic really well, at least in terms of the British media, and many other media outlets too. And quite rightly, they must be doing something well, you would presume, for that coverage, and that's not something that I'm here to dispute at all. I wanted to lay out a few comparisons so you could see maybe why these two leaders are so well regarded and what they're doing. So New Zealand has a population of about 4.8 million. It's had 1,500 cases. It's had about 4 deaths per million, and it's got a population density of 18, and 87% of its population live in an urban area. Now I lived in New Zealand, I lived in Auckland. Pretty much everyone in New Zealand lives around Auckland, you could say. It's very sparsely populated. New Zealand. It's a beautiful country, lots and lots of wilderness, lots and lots of expanse. That can be one massive factor, and that's not to denigrate Jacinda Ardern's work at all. But if you think about it, compared to Britain, physically it's 2 islands, both roughly the same size as Britain, I would estimate, but 4 million people spread across those 2 islands, most of whom are concentrated around Auckland in the north there. She's a young leader, relatively speaking. She's 39, about to turn 40. She's been in power for 2.5 years. She's head of the Labour Party, which would be considered a centre-left party. And her response has seen her go on Facebook Live. She's done updates from her home. She's put this message of kindness first and sort of community spirit, and a very functionalist, you could argue, sense of helping out each other and working together. And she put in a 14-day quarantine period from the 14th of March. So very early action, and that's something that a lot of the articles come back to and praise, this idea of communication and early action. Angela Merkel, she, in Germany, far bigger population, 83.7 million, so bigger than Britain. 158,758 cases and 73 deaths per million. Germany has far denser population, 240 people, and 76% of Germans live in an urban environment, so a city of some sort or town of some sort. Angela Merkel is a very experienced leader. She's been in power in Germany for 15 years, and she's from the Christian Democrat Party, and she's a centre-right politician. So you could argue centre-left, centre-right, are they very different in terms of political ideas? There's a common ground there between these two leaders. But the other thing which is really important, extensive testing from the outset, lots of intensive care beds in Germany, and really forthright communication and reminders from Angela Merkel to the German people. So you can see there's a lot of differences here between the two leaders, but they're being praised for and showing, arguably different results. Been way more deaths in Germany in terms of population density and in terms of total cases, but the picture and the presentation and the context around what's going on has seen both women rightly praised for how they've responded, and there's a clear connection there, as it were, in terms of what they've done and how they've presented themselves and the action they've taken. Now, if we look at these other leaders, they've perhaps not received as much public attention compared to the other two, and they're sort of a supporting cast, as it were, in this narrative. And we want to think about this. Denmark and Finland are Scandinavian countries. They're in the north of Europe. They have fairly wealthy, high tax rates. You could argue they have a very different outlook and a very different culture to a lot of countries. So there's that which we can pay into. Denmark have had 74 deaths per million. Finland have had half of that. And again, the GDP of both countries is fairly high, 35 and 42 in the world. So they're fairly wealthy countries, and they have, ridden out these effects. Taiwan, really difficult. Again, the deaths per million and the GDP are estimated because of the political tensions with China and the fact that China is the kind of epicenter of this, as it were, and the start of the pandemic, arguably. And the response in China was very, totalitarian, as you'd expect. Taiwan is slightly difficult to work out, and because of where it is and the idea, from a Chinese point of view, it should be part of China, and Taiwan would see itself as an independent nation, etc., etc. Very wealthy nation, incredibly low death rate, but also it's dealt with pandemics before. Asia had SARS and things like that relatively recently. This pandemic, is probably the equivalent with Spanish flu in 1918. So it's been a century between an event like this as well. Now, St. Martin, from what I could tell, it's the Dutch part of one island, so it borders there's a French half in the north and a Dutch part in the south, and finding the GDP was impossible. I searched for ages, couldn't find it, and the death rate is incredibly high, but it was hit relatively recently by a hurricane, and that completely destroyed the country. So the infrastructure, the economy is going to be very, very different. So that might be why St. Martin is the outlier, and the death rate is so comparable to the United Kingdom, even though it's vastly different. It's a Caribbean nation, very, very different. So what can we compare here? Is it social attitudes which have helped people in these times? Is it the fact that the social attitudes have led to them electing women, so there's kind of a cause there, a causality, or rather I should say, which has led to this assumption? How might we explain these ideas as sociologists? Well, it's really difficult, because we're taking numbers and we're taking them in a context. It's really hard to make these meaningful comparisons, and that's what sociology is about sometimes. I would urge you to look at all of these things and make your own mind up. What do you find fits the best? What's the most believable? Because it's clear that female leaders have done really well in managing the pandemic. Have they all reduced deaths and saved lives? Well, that's for you to decide. Have they done it to a greater extent than male counterparts? Perhaps. One thing that really came across with the earlier meme, for example, I saw someone share it on Twitter saying, "Don't share this meme," which is a bit ironic, but the whole argument was, well, actually in Taiwan it's a male doctor that's done everything, and he's engineered it all and masterminded this, and it's not about women. And this was purportedly shared by a woman as well, who ran this account, so I found it really interesting. I think this whole narrative, as you can see from that, it provokes a reaction, which is the idea of the media, and that's something we want to consider too. What is it selling to us? Is it selling an idea? Is it selling our own biases back to us? Is it just something which is going to get clicks and therefore ad revenue at a time when people are at home reading the press and looking at for answers more and more? How does the UK compare? It might be really difficult for us sitting here in the United Kingdom to really answer that, because our experience of this is completely encapsulated by being in the UK and by being exposed to the UK media more than any other source perhaps. Obviously as well, we know Boris Johnson far better than these other leaders, so we have our own biases, our own experience of him. We know Boris Johnson as a public figure in terms of politics for many, many years. He's been in the job for less than a year, about 3/4 of a year now, but he has been a leading Conservative MP rather than a Prime Minister for a long time. He's been the Mayor of London, our capital city, a very urban population, and he will have been used to dealing with a job and a pressure that comes with that too. Now, Britain has a population roughly of 67.8 million, and we've had 157,000 cases, so a smaller population than Germany, but a very similar amount. Our deaths per million has been much higher. Our population density is 281, and about 83% of Britons live in a city. So in terms of how a pandemic would spread and the fact that London is so vastly populated and densely populated, you could argue that by having such a big city within our country, we're going to experience more deaths. But then again, New Zealand has a similar scenario, but the rest of the country isn't as well populated. So the comparison isn't necessarily fair. In Britain, we've seen life expectancy massively increase, infant mortality decrease, and the urban population increase. Not just since the 1950s, but since the 1900s, since the end of the Victorian era and when Marx was writing. But the 1950s seen the sharpest change in those. The graphs, the curve on the graph really changes into a positive way. So maybe you could argue this pandemic has come at a point where Britain is we're so well developed, we're living so much longer, that it's inevitable that a disease like this, without warning, is going to kill far more people, because there's way more people who have lived longer than they should have done or would have done in another time period. Can you blame Boris Johnson for that? Can you blame anyone for that? Those are questions we would need to ask. The fact that he's the Conservative Party, they are a right-wing party. Boris Johnson would say he's actually more progressive centre-right if you look at how he personally sees his vision for Britain. The press would dispute that. And again, we need to look at what does that mean. Is he comparable to sort of Donald Trump and the neoliberals of the 80s, the Reagans and the Thatchers? Possibly not. The response from Boris Johnson has been interesting because, as you can see that small image there, he gave a response to camera where he was clearly very ill, and we know he was hospitalised with coronavirus himself, and said he was going around shaking hands and wasn't following the advice, as it were, to protect himself. So as a leader, what does that show? Well, it shows that he got the virus, it shows that he got ill, and it shows that there's been a change. There was this concept of herd immunity. I think the phrase that he used was, we would take it on the chin. Then social distancing and the measures for essential workers was introduced formally on the 23rd of March, so full 2 weeks after New Zealand, after Germany at least. Likewise, though, we'd seen what was happening in Spain and in Italy and the rest of Europe before Britain was really affected in the same way, because of geography and because of the spread. So there was a preparation lag there as well, or a time for preparation and a time for action, which the Conservative Party and the government will be judged on. We have the 6th largest GDP in the world as well. We're an incredibly wealthy nation. So in terms of class and the population and how much money we have, that may be a factor as to how we can deal with this, or how we should be dealing with this as well. So that's something that really is impossible for us to do right here and now. You'd have to go away and devise your own measures of what you want to do there if you really want to examine this and see if it's a fair comparison. Is it fair to say Boris Johnson has done worse than all of these female leaders because of the fact he's male? One note when it comes to this idea of, socialisation. He's talked about an enemy, he's talked about warlike language and invoking World War II. that's a very masculine trait and a very sign of masculine leadership, you could argue. So the language used and the mentality and the psychology could also be something that you would want to explore in this hypothesis. Has the female leadership around the world done that? Has male leadership done it, but dealt in a similar in a way which is more praiseworthy? I hope by now you're seeing a sociologist as complex, and there's a lot to it. There are a lot of sociological issues raised by this video and by this whole argument. We've looked at news values and narratives. Why would the news benefit from portraying this narrative? Why would they focus particularly on the female leaders and maybe not so much on the male leaders with comparable stats, comparable measures, comparable actions? What does that do? I hope you've seen that interpreting the data and applying it to society is incredibly tricky. We can only make broad brush statements, and comparisons across countries is really difficult. There's feminist and functionalist arguments which come out here, Marxist too, and Weber. All of these sociologists have learned about. Their arguments are kind of implied in a lot of what we've talked about, whether it goes all the way back to the home and this idea of nurture and nature, whether it goes back to this idea of socialization and power, and what a leader should do and what they should look like. Also the fact that demographics vary massively across the globe, and the virus itself isn't just dropped on us equally, it spreads. So it starts in one place and moves around, and it moves around at different rates. Some countries have completely shut their borders off at a time when others haven't. So has that had an effect? Again, if you look at, say, a radical sociologist like Illich, who would say that the modern world is far too reliant on medicine, and medicine is there for everything, and there's a pill for everything. Does that actually apply to every country? Is that just richer countries? Is that just countries where, like America, the health service is just for profit essentially, and it's a business and it's about the market, versus, say, these countries where you have a more social inclusion aspect to their health services and the idea of not letting people suffer because they can't afford healthcare? And we talked about Weber and different types of leadership, traditional leadership, who's part of, certain groups within their own countries. Boris Johnson himself is part of the elite in this country. He's gone to the fanciest private schools. He's part of the old establishment. Have other countries elected more leaders from a humbler background, perhaps, or from a different context in terms of their country and their class system? Is it fair to compare the two of them? And then there's stereotypes and bias. You might already have a perception of what that country is like, what those people are like, what those leaders are therefore going to be like, and how they're going to deal with this. So there's many different ideas that you want to unpack, not just in terms of the sociological aspects, but also media too. What media is reporting this, how are they reporting it, why are they reporting it, who is their audience, who are they trying to convey this message to, and why. I hope you found this really interesting. I hope it's reassured you and it's given you a lot of things to think about. Keep reading the media, keep looking at the news and criticising it and being critical in your analysis. Think about what's going on, what is it showing us and why, and how does it affect us. Obviously, if you've got any questions, please leave comments below, please email me, see me in the Google Classroom. I hope you're all doing really well, I hope you're keeping safe, and I look forward to seeing you again in the classroom soon.